would jabber. He had a lot of speech problems, some things we couldn't understand. He would scream, he would holler.
She did not want to use her feet. You would pick her up and she would just have her legs up. You couldn't get her feet down. So that was tricky to then try and help her learn how to walk because she didn't want her feet on the ground.
There were a lot of tantrums, a lot of screaming, a lot of banging.
Hello, my name is Jean Farr, and I am the CEO of NAD. I have over 40 years of professional experience working with people with a dual diagnosis. I'm also a very involved family member. I have a brother and a nephew who experience both intellectual disabilities and mental health challenges.
My name is Ruby Love, and I am Jeremiah's grandmother, or in other words, Nana.
My name is Emily Brayman. Eden is my 15-year-old daughter.
My name is Wendy Chan. Blake is my son, and he is 15 years old.
He was a great little guy. At 18 months, he was talking, and he would take a screwdriver and try to take things apart. At 18 months, he started jabbering and not doing those things. All along, they said, we think that he is autistic. He was officially diagnosed at 10. He has anxiety, and he is on medication for that.
I adopted Eden and her older sibling from the state of Oregon. She experiences Down syndrome. She currently has diagnoses of attention deficit hyperactivity disorder and anxiety disorder, and we're in the middle of an evaluation for obsessive compulsive disorder.
Well, when Blake was about 2 years old, he was diagnosed with pervasive developmental disability, so PDD, because at that time, PDD did not come under the umbrella of autism. Blake has OCD, he has impulsive control issues, those multiple diagnoses that often go hand in hand with autism. When Blake was 5, PDD came under the umbrella of autism, so then they said he had autism.
Family members of an individual with IDD can face an enormous amount of obstacles in getting a proper diagnosis and securing supports for their loved one.
When he started kindergarten, it was hard for him to socialize with the other kids. And so he would hide under the table. He would not do what the teacher wanted him to do because he just was afraid. He didn't associate with those other kids because they didn't accept him for who he was.
Everybody wants to have Down syndrome be the reason she struggles, not realizing that there could be or is more going on there, either fear-based, anxiety-based, ritual-based behaviors. And so that, I think, negates the ability to really properly look at what supports could help her and what needs to be done.
I would say foundationally, a lot of specialists perhaps don't have experience with autism. And so a lot of the behaviors or issues that we have, they say, oh, well, your son is autistic. And so that's just being part of autism. And I know my son, and I don't know all kids with autism, but there are times when behaviors get much worse or much different from sort of his baseline of autism. And so that's very difficult to talk to specialists who just chalk up any sort of behavior to autism.
Rather than just focusing on behaviors, a successful provider will take the whole person approach. They will look at everything about the person, their biology, their culture, psychology, environment, their social setup, everything about them. It's absolutely essential to look at all aspects of a person to be able to develop meaningful supports for them.
I would say a telltale sign of a good clinician is one that says, I need to get to know your son. And it's not going to happen overnight. And it's not going to happen in one 15-minute appointment. I'm going to need some time to get to know Blake so I know how to best serve your family. And that will happen, but it will happen, over the time that I spend with Blake. And those are the clinicians I know that take the long view and they have the patience to get to know my son. And those are the same clinicians that have had been, with my son for years and years and truly know my son's baseline. My advice for providers and caregivers and responders is patience. Really waiting, observing, asking a question kindly, quietly, and then waiting for my son to respond or seeing what he's going to do. It takes him, sometimes I have to take 10 breaths for my son to respond and process, find the words, and answer a question. He just takes more time. It's like moving in slow motion because my son doesn't communicate like other people communicate. And so he will not understand if somebody is yelling at him.
Please look beyond Down syndrome. We're all more complicated than just one part of us. And just because that is a large, obvious part of her doesn't mean that's all of her.
I would like him to reach his dreams, which are the voice acting, possibly maybe doing lights and sound.
My goal and hopes and dreams for Eden, that she's, if she wants, live on her own. With me as a supporter, not as me as necessarily a roommate. We're still family, still go on family vacations together, go camping and all that, but I want her to explore what she likes.
I think like the rest of my kids, I want Blake to be happy and to find his own journey and to figure out what makes him happy and to figure out his passion. So I want him to be able to have a passion and to pursue that passion. And I want him to have meaningful relationships in his life. And of course, I want him to be as independent as he can be.
Here are the major takeaways from the families who shared their experiences with us. Get to know the whole person before developing a plan. This includes gathering input about them from everyone who has a role in their lives. For young people with complex behavioral challenges, learn and understand what their baseline behaviors are so that you have the full context for treatment planning. Look beyond the existing disability diagnosis for other possible medical or mental health issues. When communicating with the person receiving services, give them time for processing the information that you are sharing. Project patience and calm. Here are a couple additional best practices to consider in your work. Look beyond the diagnoses into the heart and the spirit of the person. No matter the severity of the issues you are trying to address in your treatment or support planning, assume capability. When in a team meeting, talk directly to the person receiving services first, and then their family members and other support professionals. Engage with the person and their family in the same way you would want your close family members to be treated. Each person with IDD and each family member supporting a person with IDD is unique. However, as family members, we're all the same. We want what's best for our loved ones. We want our loved ones to have dreams and goals and lead a happy and satisfying life.